So what exactly were those targets? Well, there's a couple of them. And I mentioned, you recall, emotions being important, particularly some negative emotions like anger. And I also talked about physical sensations. So one of the places that we started with is helping her realize the function that avoiding craving serves. So what we helped her see is that when she was smoking a cigarette, what it allowed her to do was to temporarily avoid the trigger, which was these physical cravings in her body, those sensations in her chest. And anything that allows us to distract or to avoid, at least temporarily, like smoking, is something that's highly reinforcing. So what I did is I talked to her about how when you have a cigarette and you're trying to avoid a craving, what it actually does paradoxically, so is opposite of what we intended, was that it leads us to have even more urges. And it actually leads us to smoke even more. So I had her try out something really simple. I said, for the next 30 seconds, close your eyes and don't think about smoking. So just do everything you can to not think about smoking. Don't think about what it tastes like. Don't think about what it feels like. Don't have any images in your mind of smoking or of you smoking. And I'll say to her, I'm going to go silent for 30 seconds while you do that. And of course, when I did that and I asked her, what happened? She said, for a few seconds it worked, but the more I tried to not think about smoking, the more I thought about smoking. And so this little 30-second exercise was just a way to illustrate that paradox, that the more we try to avoid and distract, the more we get what we're trying to avoid. And so that was really helpful to her to understand in a metaphorical way how smoking functions. It allows us to temporarily get relief. And like in a lot of different act exercises and act illustrations, metaphors and experiential exercises, of course, are a fantastic way of getting a point across. It's better than merely explaining something to them. And that seemed to make an impression on her. And that was very, very helpful. So the next thing that I did was we have to go from, okay, she saw that avoiding doesn't work, distraction through not thinking about it has a paradoxical effect. What do I do? So here is where I turn toward a very popular exercise that we use in all of our programs here at the Cancer Center in our quit smoking programs using ACT. And as we talked about the urge monster. And there we illustrated this idea that dealing with urges to smoke is like being in a tug-of-war with an urge monster. And the monster is pulling at you, and you pull back. And the more you pull, the more the monster pulls back, and the bigger that the monster gets. And so what I helped her see was that your job isn't to win the tug-of-war with the urge monster. Your job is to do something very counterintuitive. So I kind of paused for a moment and I let her process that and say, what do you think that is? Would you pull harder? Would you just stay there in the war against the urge monster? What would you do? And she was a little bit confused. She wasn't sure what I was really getting at. So I kind of helped her along and said, this monster, this craving monster, urge monster in your body is going to keep fighting you. So if you keep pulling, it will keep pulling back. And then she finally got it that maybe this is a waste of time, that maybe the best thing to do is just to let go of the rope. And I said, that's it. That's exactly what you need to do. You have to let go of the rope, free up yourself to spend your time doing other things rather than fighting cravings by having a cigarette. And so her next question was, okay, so what do I do? That's an interesting idea, neat metaphor, but what do I do when I have a cigarette? And I said, well, what we're going to do is we're going to teach you how to let those urges pass, how to let you drop the rope. And in fact, that's actually the whole crux of this program. It's the heart of the program. And actually, if there's nothing else you take away from listening to me today, my hope is that the one thing you remember is how vital it is to show someone how to let those cravings pass. And so it meant focusing on the sensation in her body, in her chest, focusing on the sensation or feeling the emotion of being angry or feeling shame, and working toward letting it pass, letting it be there without trying to act on it by having a cigarette. This is the number one mechanism of change that has led to success in quitting smoking in our clinical trials. We have done about 8 randomized trials of ACT on various platforms for various populations. And when we look at why the treatment is working, it really comes down to this one key mechanism, and that is allowing the cravings, allowing the emotions, and allowing the thoughts to come and go on their own without trying to act on them. It really is so important, the acceptance. And the way we call it in our program is just letting your urges pass. And so the how of how you let urges pass, I'm going to show you, but it's this central idea that I want to keep coming back to, and that I kept coming back to with Jane, because every exercise in acceptance is an exercise designed to help you have a craving, have an emotion, have a thought, and let it pass, which ties back to the clinical functional analysis that we did at the beginning, and why that is so important at the very beginning, because it all ties back to learning, well, what are your triggers? Because if you know those triggers, then you and the client see how central it is to teach these skills on letting emotions, thoughts, and cravings to pass.